Hi, I'm Isabel DeConti-McLenany. Thanks for joining us here in New York City. You're watching the Skin Sage channel, your fast forward to skincare news brought to you by our board-certified dermatologists. Making headlines in the skincare world today. The New York Times recently published an article titled, "An Old Medicine Grows New Hair for Pennies a Day." And it certainly has tongues wagging about Minoxidil, breathing new life back into what most of us know as Rogaine. With us today is Dr. Radha McLenany, board-certified dermatologist and founder of online dermatology platform Skin Sage. Welcome, Dr. Radha.
Thank you. Happy to be here and do a deeper dive into minoxidil and hair loss.
I know our viewers have lots of questions on this new news, but first, a quick little history lesson. Minoxidil is the key ingredient and generic name for topical Rogaine, which was first approved by the FDA and introduced to the market in 1988 for men, and later for women in 1992 to remedy hair loss. Minoxidil was originally an oral medication used in a high-dose pill to treat high blood pressure, and that's when its hair growth capability was discovered by pure accident as a side effect. Then Rogaine got approval for a topical foam formulation applied directly to the scalp at a 2.5 and 5% solution. So Dr. Radha, why the renewed interest in a hair loss remedy that's really been around for decades?
Well, topical minoxidil comes with many challenges. First and foremost, it's not user-friendly or convenient and frankly causes a sticky mess of your hair, making it impractical for daily use for many people, especially if you need to be out and about in public and working most days. Rogaine does have to be used twice a day, and in addition, the vehicle, which is either a solution or foam formula, can be extremely irritating to the scalp, and for many it can even cause an allergic reaction called contact dermatitis. Now, that doesn't mean an allergy to the minoxidil itself, so the good news is that these patients might still benefit from a low-dose oral formulation rather than the topical.
Well, so is the low-dose oral prescription pill FDA approved for hair loss?
That's a great question. No, it is not. But that's okay because there's a little thing in medicine called off-label use. So doctors are able to prescribe drugs for conditions different from what they were originally approved for. So for example, we often prescribe topical tretinoin for reasons other than acne, such as for anti-aging and melasma. And in fact, many dermatology treatments are commonly prescribed for off-label reasons. I've been prescribing low-dose minoxidil orally for years, and it is very inexpensive. Unfortunately, if a pharmaceutical company does decide to invest in FDA approval for low-dose oral minoxidil for hair loss, this could eventually drive the price up. But for now, it's, as the New York Times article states, pennies a day. And it's pretty easy to prescribe, which we do for our Skin Sage patients.
And is the low-dose oral minoxidil good for all patients who have thinning hair or who are purely bald? In other words, does it work for everybody?
We prescribe it for male and female pattern thinning, and it is most effective prior to significant hair loss. It also has a few side effects which you need to be aware of, including increased hair growth in unwanted areas such as the face and the chest, as well as water retention and swelling in the legs. I typically do not prescribe minoxidil to patients with underlying cardiac conditions or during pregnancy or breastfeeding.
That segues into hair loss. What kind of hair loss is reversible? And what causes hair loss?
Well, reversible hair loss is generally non-scarring, and it includes hair loss that's caused by vitamin deficiencies, medications, or infections. So while hormonal hair loss isn't completely reversible, it is preventable if you start early enough. Same with some autoimmune scarring hair loss, which if caught early and treated, can be prevented from worsening. It's very important to see a dermatologist for a hair loss consultation before starting any treatment. And sometimes this does require a biopsy since people may have an overlap of conditions for their hair loss, and scarring hair loss in the early stages can be pretty subtle. I typically spend a lot of time with my hair loss patients, and it is important to understand that not all treatments are effective in everyone, and it does take time to see results.
You and the Skin Sage dermatologist specialize in integrative medicine solutions. So what do you suggest in terms of integrative protocols for hair loss?
Rosemary oil topically is as effective as topical minoxidil. We believe both work to increase blood flow to the scalp, which increases hair growth. And in the same vein, peppermint oil is likely to be effective as well, although there aren't as good studies on that one. In addition, we do use what's called 5-alpha reductase inhibitors. These are anti-testosterone type of medications, such as finasteride and dutasteride. We use these in both men and postmenopausal women for hormonal hair loss. We also use oral spironolactone. All of these have anti-testosterone type effects and improve androgenetic alopecia. And finally, there's pumpkin seed oil and saw palmetto, which work similarly, and they can also be used orally.
Well, this is valuable information for our viewers. Thank you so much, Dr. Radha, for joining us today.
Oh, it's great to be here, and there's plenty of alternative customized plans for hair loss, which the doctors at Skin Sage can help with.